Right. Good day, students. So we're gonna start your malaria first practical, where you're going to learn two things: staining a normal blood film and try to find a good area to screen malaria parasites, and then you will be given a positive slide. You have to screen that for malaria positive stages. So there are steps in your first half of your practical. The step 1 is to identify the correct side of your slide. So that's your first step, and we're going to demonstrate this again. And your second step would be, you need to keep your slide on, keep the slide on a balanced, this is the must, balanced track. So there are tracks, plenty of tracks, some of them are not balanced, so you better take a step to balance the track first and then keep your slide on the track. When you are keeping the slide on the track, make sure you will keep the smear side on top, and if you are going to stain the other side of the slide, you will miss your entire practical. So third step is to stain. So you need to stain your slide. So this will be demonstrated by demonstrators. There will be a demo for this, and then after that you need to dry it properly before you start your screening, because the slide with water or wet slide cannot be screened for malaria parasite, because you are going to use oil emulsion. You are going to put oil and water is not going together. Therefore you need to get a very clean dried slide before you start screening it under oil emulsion. And the fourth step, before you start putting your slide into the mechanical tray of your microscope, you need to check again the correct side, because if you put the other side of the slide for screening, again you will going to miss your practical. The reason, you won't be able to focus your slide under oil immersion if you put the other side of the slide. You need to put the smear side on top of the mechanical tray, and therefore I'll put the step 4 again. You need to identify the correct side of your slide. And the next step is the step 5. There will be a demonstration for this, how you're going to identify the correct side of the slide, and then you need to keep your slide on the mechanical tray. Next is to place this slide properly. Place your slide on the tray of your microscope. And then the final step, the screening. Again there will be a demonstration and an explanation how you're going to do the screening. So there are 6 steps, and each steps you will have different videographs to follow. Thank you.
Precautions in handling a blood sample. Collection and handling of blood sample present a potential risk of infection. So, this can be reduced by taking following precautions. Wear protective gloves when handling of blood or taking blood samples. Cover any cuts or abrasions on your hand with adhesive dressings. Take care not to prick yourself or others with any sharp instrument that has been in contact with blood. Never use disposable lancets more than once. Always wash your hands with soap and water after completing your task. If blood gets contact with your skin, wipe it off quickly with alcohol cotton wool and wash the affected area with soap and water as soon as possible. Type of sample required for malaria diagnosis. Whenever possible, the specimen should be collected before the treatment. The blood for malaria parasite detection can be taken by finger prick method or by venipuncture. Ideal blood sample obtained by pricking a finger or earlobe. Because density of developed trophozoite or schizon is greater in area where it has capillary blood supply. Malaria is excluded with 3 negative smears taken 12 hours apart. But further films are needed if clinical suspicion is high. Label the slide with a wax pencil by writing at one end of the slide. The label should contain the patient's name or reference number and date. Method of capillary blood collection. Clean and disinfect the finger with cotton wool soaked in 70% alcohol solution. Puncture the ball of the finger with a sterile lancet. Thin smear preparation. Apply gentle pressure on the finger and collect a single small drop of blood on the middle of the slide. Wipe the remaining blood away from the finger with a piece of cotton wool. Use a second clean slide as a spreader. Touch the small drop with the spreader and allow the blood to run along its edge. Firmly push the spreader along the slide, keeping the spreader at angle of 45 degrees. Make sure that the spreader is in even contact with the surface of the slide all the time the blood is being spread. Thick smear preparation. Apply further pressure to express more blood and collect 2 or 3 larger drops. Using the corner of the spreader, quickly join the drops of blood and spread them to make an even thick smear. The circular thick smear should be about 1 cm in diameter. Allow the thick smear to dry. Staining the blood film.
Now the next step, you have to identify the correct side of the slide. Can you show me the correct side of the slide?
Yes, sir. First, we have to hold the slide in correct orientation. And the next step is identifying the areas of the smear, which is the head and the body part and the tail with the spines. And next, we identify the correct side of the slide. The other side of the slide won't scratch, but the correct side of the smear would scratch and leave a mark. And our next step is to balance the rack. We have to balance the rack on the table and make sure it is not moving. And then we take the slide and place it on the rack over the sink with the correct side on top, like this. and make sure the taps are open so that any spillover would rinse off the sink. And now we are ready to stain the smear. We use the Leishman's stain for this. We have to use 10 drops of stain to stain the smear. And we start with the tail end of the smear. You have to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we have to leave the stain for 30 seconds. This is how the slide should look after 30 seconds. The entire smear should be covered with stain. And next, we have to dilute the stain with distilled water. We have to double the number of drops of stain that we used, and therefore we have to use 20 drops of distilled water on the smear. One, two, three, four. This is how the slide would look after dilution. And we have to keep this dilution for 10 minutes. Throughout the 10 minutes, the solution should be moved by blowing on the slide. This should be done from time to time in order to prevent the stain particles being deposited on the slide. We are ready to wash off the stain from the slide. For that, we have to first make sure that you get a gentle stream on the tap. After making sure the stream is gentle, we have to get the slide horizontally and carefully over to the water stream. We have to hold it from the head end of the slide. And you get the water to flow over to the slide through your fingers. How to dry the slides. This can be done in two ways. You can move it in there quickly. Now this is a bit risky because you might lose the slide, or you can use the option of drying it by a fan. This is how the slides should look after drying.
Now, the next important step would be the identify the correct side of the slide again. To do that, you need to see your stain slide. Now, this is one of the stain slides done by one of our students. And look here, the smear is not well stained. If it is well stained, it should be nicely and brightly seen. Can I show you a well stained slide? And this look bit better, and again not the ideal but bit better. You can see the dark stained smear here, and the tail end can be nicely identified, and the head end also can be nicely seen. And can you identify, I'll give you this slide, can you identify the correct side of this slide, please?
We get the slide, hold it from the head end again, and then we scratch on the surface to make sure it is the slide of the smear.
Screen in the blood film. Switch on the light source. Place the dry stain slide on the stage. Make sure that slide is not upside down. Secure the slide to the slide holder of the mechanical stage.
Next, step to keep this slide properly on the mechanical tray of the microscope. So can you identify the correct side of this slide?
Yes, sir. Using this scratch.
Right. Can you place this slide on the mechanical tray using the correct procedure?
Okay. First, I'm going to turn this into the lowest power possible, which is 4x. Then I'm placing this slide on the mechanical tray of the microscope. Then using the coarse focus, I'm focusing it.
Rotate the nose piece to bring the objective into the position and raise the stage into its maximum. Move the slide with the adjustment knobs to bring the tail end of the blood smear into the field of view. Examine the tail end of the thin blood smear where the red cells do not overlap with each other. Focus the tail end of the blood smear under 10 times objective into position and raise the stage into its maximum. Focus the tail end of the blood smear under 10 times objective using quartz focusing. Obtain sufficient illumination by closing or opening iris diaphragm. For low power objectives, light has to be reduced, and for high power objectives, it has to be increased. Shift the 10 times objective away and add a drop of immersion oil onto the illuminated spot of the smear and bring the 100 times objective into position. Open the iris diaphragm fully. Focus the cells using only the fine adjustment knob. Identify the species and stages of any parasite on the smear. After examination, lower the stage and swing the lowest power objective into position. Wipe off any oil from the lenses and the microscope stage using lens tissue that has been provided. Then switch off the microscope.
Right. So now we have to screen the slide as the final step. Now screening, I would like to give you some theory before you start it actually using the microscope. Screening the slide. Mayumi has shown you how to put the slide and focus the tail end using the 4x. Say for an example, this is the field that you are seeing. When you focus the slide under 4, you will see the tail end like this with the spikes. And then the next would be you focus the same field using low power. 10x means low power. So when you focus this under low power, the same tail end will be magnified and you will start seeing tiny cells. Towards the tip of the tail end, cells are not detached each other. But when you come little closer to the body, you will see an area nicely where the cells are separated each other. To confirm this area, whether the cells are really at a single layer, you go and confirm your area using 40x. Now the 40x is high power. We're going to use the high power where you will see a magnified the tail end where the cells are nicely seen, and if you see an area with cells separated each other like this, this is a good area, and this is the area that you should select for screening. If you see an area like this, there are clumps of cells. The cells are superimposed. This is not a good area. And if you see an area where more than one layer of cells, that again not a good area. You must select an area like this to screen for parasite further. The malaria parasite is an intracellular parasite. You need to see the inside of the red cell. To see the inside of the red cell, you need more magnification. The 40x, the higher magnification is not good enough to see the intracellular parasite. You need a little bit higher magnification. Therefore, we are going to use the 100x. 100x has given a different name. The 100x you cannot use a lot. You need oil. Therefore, we identify this objective as oil immersion objective. So you use 100x, and I'll teach you how to put the 100x while demonstrating how you are going to do it using the microscope in a little while. But when you screen this under 100, the cells are much bigger. Therefore, you will be able to see the intracellular parasites nicely.
In thin smear, sensitivity is low. There is only one red blood cell layer. In low parasitemia can miss the diagnosis. In thin smear, sensitivity is low, but specificity is high. It is used to confirm the species and stages of malaria parasite present. It is fixed in alcohol. In thick smear, sensitivity is high. There is 20 to 30 layers of red blood cell. It is better in detection of low levels of parasitemia. Its specificity is low and it is not fixed in alcohol. Stages of Plasmodium vivax. Ring stage. Red cell is enlarged. Red cell surface may show very fine pink dots, stippling or Schaffner's dots. With the standard stains, the cytoplasm stains blue and the nucleus red in color. Parasite shows a quasi cytoplasm with a single nucleus. Amoeboid stage. Red cells enlarged. Stippling is visible. Amoeboid trophozoites has irregular cytoplasm with scattered yellow-brown malarial pigment and a single nucleus. Mature schizones. Red cells are enlarged. Stippling is visible. Nuclei is pink in color. Malaria pigment clumped in the center. In both female and male gametocyte, red cell is enlarged. It has Schaffner's dots, and parasite occupies almost entire cell, and it has evenly scattered malarial pigment. But the difference is female gametocyte nucleus is compact and it is usually centric. Male gametocyte nucleus is usually diffuse and it is central. Stages of Plasmodium falciparum. Ring stage. Red cell not enlarged. Cleft may be seen in the red cell. Small, delicate, thin hair-like ring of cytoplasm stains blue with standard stains, and the single nucleus stains red in color. Multiple infection and infection with polar arranged nucleus. Headphone shape, marginal applique, bird's eye appearance. Female gametocyte is crescent-shaped, longer and more pointed than male gametocyte. Compact pink nucleus in center. It is surrounded by black malaria pigment. Male gametocyte is sausage-shaped. It has rounded ends and its nucleus is diffuse and it has scattered pigment.